growing hub it's a growing hub for reliable data and research and analysis on issues critical to Northern Virginians. And this deep dive series is intended to provide additional insights related to both our recent report, a portrait of Northern Virginia's youth 2025, which was an update of our 2010 report. And that report is now on our website. We'll also put it in the chat. And it's also a follow-up to our recent Shape of the Region conference, which was exactly 2 weeks ago tomorrow. So I hope many of you joined us. If you didn't join us and you want to see a recap from that also, that is also on our website, and we welcome you to do that too. So this deep dive is a follow-up from our Shape of the Region event. And in this 30-minute session, we'll do a short recap of some of the key issues that were raised and also some solutions. And we'll be focusing today actually on one of the panelists that brought up some solutions. We'll be focused on some of the solutions that were discussed. And we have a guest. In a few moments, we'll be introducing that guest. Again, we had a great Shape of the Region. We were thrilled, but we heard in our post-event survey that the event was too short and that people wished we had more time to discuss these issues. And so here's an opportunity, and then over the next few months, there'll be additional opportunities as well to do some additional deep dives. So again, today's session will be recorded, similar to Shape of the Region, the conference, and also the report, and it will be available on our YouTube channel. And then please share your questions and answers in our questions, in the chat box, and we will do our best to try and answer questions at the end of the presentations. I'm now going to turn over to my colleague, Dr. Denise Bellows, who is the Senior Director of Insight Region, to take us along this journey and give us a recap of Shape of the Region and introduce our speaker for today. Denise.
Thank you. Thank you, Sari, and welcome everyone. So as Sari mentioned, I'm the Senior Director of Insight Region and excited to be here sharing about a little bit of a recap of what we learned at the Shape of the Region event. Oops, I'm going to advance these slides a little bit. Sorry about that. So I'm also happy to introduce my colleague, Dylan Scarton. He's a doctoral candidate in the interdisciplinary program in neuroscience at George Mason University. Dylan has worked closely with Dr. Holly Maddow, who was on our panel for Shape of the Region discussing some potential solutions related to substance use disorders. So we're very grateful that Dylan was able to take some time to be with us today and discuss his work with preventing adolescent risk behaviors and supporting youth with substance use. So thank you, Dylan.
Thank you.
Oh, sorry. I'm hearing that my slides are not showing. Hold on 1 second. Let's see. Share.
On the panel side, I can see them, Denise.
Okay,
maybe it's
so
the audience.
Thank you. Did you see anyone in the chat saying they can't see the slides? Because Dylan is saying that he can see them. Sorry. Let's see in the chat. Did somebody put something in the queue? They can see them? Okay.
Great.
All right. Thank you, though. All right, so moving forward, I'm just going to do a brief recap of some of the data that was in the report that Sari mentioned, just to give us some context for the discussion today. So at Shape of the Region, we shared that nearly 30% of middle schoolers feel unsafe at school. Electronic bullying increased by 30% among middle school students. Deaths by suicide are increasing among our youth, and the majority are firearm related. And finally, we learned that opioid overdose deaths are increasing, and our youth are impacted a lot more than in other parts of the country. And one comment out of that, at Shape of the Region, one of our panelists, Master Officer TJ Rodriguez, shared, quote, "A shocking number of youth are using opiates." He said some adult users are even seeking out fentanyl. He also explained that substance use leads to other risky behaviors like bullying, posting inappropriate things online, and school truancy. So this is why we thought it was important to do a little bit further a deep dive on some solutions related to what we heard at the event. And briefly, in the spirit of sharing youth voices, as we did at Shape of the Region, I also wanted to note that just 2 weeks before our event, C-SPAN announced its Student Cam winners for 2025, and the grand prize from the whole country was awarded to a 10th grader from Montgomery Blair High School, and his video was called "Teens, Social Media, and the Fentanyl Overdose Crisis." His 7-minute video starts by sharing the fact that I just shared with you, that overdoses have been increasing among youth, especially in this region. The video also starts by sharing some stories of youth in Northern Virginia who have been impacted. So the one that resonated with me was a teen who lived not too far from me, died of a fentanyl overdose within 6 weeks of being introduced to a dealer while playing an online video game. And Amanda's going to share a link to the chat if you want to hear a little bit more and watch that video. Our panel of experts at Shape of the Region discussed a lot of solutions to support Northern Virginia's youth. And I've summarized them here in 4 categories. There were school-based policies discussed, community-based programs, peer support models, and technology solutions. So on the school-based policies and programs, school cell phone bans were discussed as a helpful solution in our schools. We were fortunate to have a panelist, Mark Shriver, who shared his experience from Maryland. Maryland had the cell phone ban in place about a year before Virginia. And we also heard from Alexandria School Superintendent, Dr. Kay Wyatt, who shared about the impact of the ban in her local jurisdiction in Northern Virginia. And she had shared that the cell phone bans have increased, well, they collectively shared, that they were seeing that cell phones were increasing peer-to-peer interaction and peer-to-teacher and peer-to-adult interactions. And they increased student focus. So they were impressed that in a short period of time, they are seeing an impact on these cell phone bans in schools. Dr. Kay Wyatt also explained how these bans are critical for student safety. So while parents want to be able to reach their children during a crisis situation, during an active shooter experience, students and teachers are trying to remain as quiet as possible and avoid notice. And a parent calling a student on their cell phone could create a noise that puts the entire class in danger. So I thought that was an interesting anecdote about the value of the school cell phone bans for student safety, but also for student mental health. Several panelists also mentioned Virginia's tiered system of support, which provides evidence-based, data-driven strategies to support youth in schools at an appropriate level for each child. So this is a state-level initiative, and schools have the ability to provide some flexibility based on the needs of their school and what they know about their community. So for example, a tier 1 support would look like a classroom lesson about social and emotional learning, while a tier 3 support is usually more like an individual therapy session. So schools have some flexibility within each of these tiers to use the resources available to them and provide support within these tiers. And providing these services in schools reduces a lot of barriers to care that are experienced by many families. And so related to these barriers to care, we also talked about school-based mental health models. We learned that many schools do not even have a school nurse, and the school nurses are the ones who do the most of the mental health screenings. Funds to support behavioral mental health tend to be scarce, but are very much in need still to this day. The governor recently passed legislation to assess available mental health resources currently at schools in Virginia. So hopefully the state can use the data that comes from these surveys of schools and their mental health needs to create some informed solutions backed by appropriately allocated resources to provide school-based mental health support. We also learned about several school-based mental health models. Our panelists explained that currently many schools do not even have a school nurse. Rachel Dean of Voices for Virginia's Children explained that funds to support behavioral mental health are scarce. Oops, sorry. Several community-based programs were also discussed. Dr. Sandy Chung explained how the Virginia Mental Health Assessment Program, or VMAP, aims to address the shortage in pediatric mental health providers by training pediatricians to screen for and support youth with mental health needs. The Parent E3 program was designed by panelist Master Officer TJ Rodriguez, and that's part of a community policing approach in Manassas to engage police, engage schools, engage parents and youth in conversations to educate, empower, and connect them to community resources. Several of our panelists, including Dr. Holly Motto of George Mason University, described the value of evidence-based peer support models. Notably, at Shape of the Region, youth speaker Morgan Stiller described how she found the Rambassadors Peer Support Program at Robinson High School. Rambassadors creates a supportive and welcoming culture among youth at school. And this program has been adapted by the Fairfax County Public School System as a mentorship program to teach schools about outreach, fundraising, and community building. We also learned about Serve Virginia and AmeriCorps' Youth Mental Health Corps. This is a really exciting program that trains youth with the tools they need to be peer mental health supports. And it also provides them training that could support them in pursuing future behavioral health careers. So the Youth Mental Health Corps offers young people training, skills, and experiences and credentials just to start a career in behavioral health. So it may also help our, we talked about a workforce pipeline issue also in this country with not enough peer mental health care providers. So in the state of Virginia, so the Mental Health Corps is already active in Colorado and a few other states. In fall 2025, the Youth Mental Health Corps will be available in the state of Virginia. Finally, related to the opioid crisis, we learned about a technology solution, the iConnect app, which connects people with substance use disorders to needed resources. The team that developed this app also has a wealth of information about preventing youth risk behaviors, and they also strongly encourage these peer support models. So I'll turn it over now to Dr. Dillon to share more about his app and his team's work with Recovery Corps.
Thank you, Dr. Denise, and thanks again for the invitation to be with you all here today. Our iConnect app is a passion project that was born out of a community-based interdisciplinary research program at George Mason University. We started back in 2021 by interviewing a variety of subject matter experts and different community stakeholders with lived experience to identify what their pain points are and what additional support they could use in their work. After many conversations with these individuals, we converged on this idea of resource navigation. There are a lot of resources in this area, and navigating them can be somewhat of a convoluted and complex process. So we created the app to help connect people in need with recovery resources in their local community. This app could be a powerful tool in preventing youth risk behaviors by providing easy access to these critical localized resources, as well as helplines and support groups that foundational research and successful evidence-based peer programs have shown are important to reduce risks in youth. Now, we have a fantastic team that spent many hours collecting these resources and building the iConnect app from the ground up. But recently, we were selected as a site partner by a wonderful group called Recovery Corps that supports people in recovery by providing personnel to organizations that are aligned with their mission in the form of peer navigators and project coordinators. Later this year, they'll actually be helping us to find a local project coordinator to advance our mission in the community. So they'll be helping outreach and building more resources into the app, verifying that the information we have in the app is accurate. So really forming those connections that are so critical to work like this. Next slide, please. All right, so let's talk about the app, iConnect SUD. We put that specific term on the slide because there are other apps that might come up if you search iConnect in your preferred download app or app store. So if you search iConnect app, you'll see our logo as shown on the screen there. It is available for download for free in both the Apple App Store and the Android Google Play. We also have a website, a Wix website that will be shared in the chat if you want to read a little bit more about us. But iConnect SUD, so we're a mobile application that's designed to connect individuals struggling with substance use disorder to a wide range of community resources, support groups, and professional services. Our mission is to provide a comprehensive, user-friendly platform that empowers individuals on their journey to recovery while fostering a sense of community and human connections. This is something that, as I mentioned, we began in 2021. We realized in our conversations with individuals, but just amongst ourselves, we all had personal experiences in this area of substance use disorder. We realized human connections are so critical to this work. So that's, again, a large inspiration for us. Again, you see the QR codes on the screen. The app, once more, is publicly available for download if you'd like to see it for yourself. And again, the website can share a little bit more information about us. But let's get into the app itself. We have a couple screenshots there on the screen. The leftmost one is our homepage. After you create an account, you log in, that's exactly what you'll see. And what it allows users to do is change their location, which you see at the top. It's defaulted to Fairfax. You can either manually enter the address, or you can have it automatically detected if location services are enabled. And most of our work up to now has been focused in Fairfax, since that's our primary area where we're located at George Mason, where we live, where we work, but we have expanded efforts to both Arlington County and Loudoun County as well, with plans to advance further to Prince William County and others in the area. So we continue to grow. But a user can change their location, either manually or have it automatically detected. Right below that, you'll see a search bar where a user can enter the resources that they're searching for. What's nice about that feature is that, say, if someone's looking for food assistance, the synonymous terms will also be returned. So if someone was to search for food, food assistance, food pantry, all of these synonymous terms will take the user to that appropriate category. Now, below that, you see all these predetermined tiles, these pre-grouped categories. A user, if they don't want to search in the search bar, they can just simply select one of those tiles. And in doing so, we'll take you to the screenshot to the right. But before I move on to that, I just want to show you at the bottom of that homepage screenshot, you see that there's also a quick start guide. There's a quick start option where someone using the app for the first time can see the steps for creating an account and using the app. There's also an SOS button there. That is a resource that can take someone directly to 988 Suicide and Crisis Helpline. So that is built right into the app. We also have a special subset right there next to it for Peer Connect. Again, a really critical component of this work is connecting individuals. So that allows a user to go just directly to Peer Connect resources like Alcoholics Anonymous or Narcotics Anonymous in their area. And then lastly, there's an option for account details if a user wants to search that. Now, let's say that the user's found a resource or selected a category. That's the screenshot we see there on the right. And you see that it's broken up into two sections. We have the map on the top. So it has green pins locating where those resources are proximal to the person, to the user. On the bottom, you see the list form of those resources. Now, if a user was to open up any of those, they would see all of the individual information for those resources. So you'd see the physical address, you'd see the operating hours, the contact details, like the phone number and the website. So it's a fairly simple interface by design. Our intention was, let's reduce any barriers for individuals trying to access these resources. It's simply a means, you could think of it like an almost curated Google search, wherein you can look for substance use disorder related resources, helping with the recovery process right here in the app. So that is us, that is iConnect, and now I'll pass it back to Dr. Denise to talk more about factors related to risky behaviors in youth.
Thank you. Thank you so much for that great overview. Give me 1 second. I see that my screen share has stopped, so I'm just going to update that one more time. But I think everyone was able to see the presentation of the app, which is really interesting and really well organized. So thank you.
Thank you.
Okay, let me just get a thumb. Can you see the next slide, ACEs versus PACEs? Excellent. All right.
Yes.
So just briefly before we get into our Q&A, one thing we know about youth who have negative health outcomes or engage in risky behaviors is that they're more likely to have experienced these adverse childhood experiences or ACEs. However, more recent research on those who experienced ACEs but did not have negative outcomes found that they were also exposed to PACEs, which are protective and compensatory experiences. So PACEs can increase a person's resilience to ACEs and reduce negative health outcomes. Now, one reason why I'm spending a little bit more time on this here today is at our Shape of the Region event, Dr. Matto, Dr. Dillon's peer, did an informal poll of the audience asking who had heard of ACEs and who had heard of PACEs. And while many people had heard of these ACEs before, few were knowledgeable about PACEs. So I wanted to take a minute here just to summarize what those 10 PACEs are. They're listed here on the slide. And we've also going to provide a link to more information in the chat. So in these PACEs, the other reason I want to emphasize this is no matter who you are, you can kind of work towards supporting youth through these PACEs, right? So this is a way that parents, guardians, teachers, even adults in a neighborhood can create positive experiences for youth and community. So we also heard, if you look at these PACEs, during our panel discussion, we heard about the importance of listening to youth, creating space, leading with empathy. And those are all things that are integrated into these PACEs. So some concrete actions, encouraging communication and asking for input, right? Going up to youth and, we've talked about sometimes adolescents where they are developmentally, they may initially give you a one-word answer. That not necessarily because they're trying to be rude. It might be that they don't want to say this wrong thing, or they're forming in their head how they're going to communicate to this adult in their neighborhood. stay with them, have patience, continue to ask for input, continue to ask engaging questions. Creating and maintaining healthy routines and fair rules at home. So that's another important way that parents can provide protective factors to youth. Encouraging friendships and modeling social group participation. So it's about the adults modeling for the youth social group participation and what healthy friendships and healthy relationships look like. Looking for an appropriate mentor outside of the family and facilitating that mentor interaction. So this is where, a neighbor could be a positive role model for an adolescent, right? Just, taking an interest in a youth, saying hi to them when you see them, trying to acknowledge positive things that they do. One thing that came out of the Fairfax County Youth Survey, only 20% of youth in Fairfax County who took the survey said that adults in their neighborhood acknowledge and recognize when they do something positive or do something well. But yet, of course, when they do something not so great, they're hearing it a lot more. I'm sure adults can be familiar with that experience too sometimes. So that's another way that, we can try to create a positive environment for youth. And then providing opportunities for youth to spend time with friends, volunteer, engaging in volunteerism, or becoming civically engaged, playing sports. These are all protective factors for youth. So these protective factors, PACEs, they also align with the factors promoted by the Fairfax County 3 to Succeed campaign. So the Fairfax County Youth Survey found that youth with 3 or more positive protective factors are more able to manage stress, make positive choices, and develop healthy habits. So more information about that campaign is also going to be linked in the chat for you to explore a little bit further. And now, without further ado, I'm going to turn it over to Sari Raskin to lead our discussion and Q&A.
Thank you, Denise, and thank you, Dylan, as well. Great information, and it sounds like the work you're doing is really impactful, and it sounds like you've really reached out to community to figure out what the needs are and are trying to meet those needs. So thank you for telling us more about what you're trying to do to try and solve some of the problems that we've raised, and it's a great solution. I wanted to just do 2 things quickly. We will take some questions. I see there already is one, and I also wanted to mention that all of the information that we put in the chat, we recorded this session, as I mentioned earlier, and so it's going to be available. I know there's a lot of information that you may want to look at afterwards. So all the links are in the chat, and it's part of the recording. But the first question is there any research available that supports PACEs? Is PACEs an evidence-led approach?
It is. Yeah, there is literature. I mean, you can, am I muted? Sorry, no, I'm not muted. Okay, good. Sorry. Yeah, PACEs it's evidence-based approach. So again, it's more recent research. I think when I was looking, it came out in the 2020s is when I kind of saw a lot more research in this area. So relatively new, but yes, I mean, all of PACEs were a factor in forming, like I said, the 3 to Succeed campaign. They list that out on their website, all of the different articles that explain where these factors come from, these protective factors. I had studied adolescent risk behavior in my doctoral program, and we called them something different as I think the literature was evolving, but we called them protective behavioral strategies. So I even have an article published in the Journal of College Health that talks about those protective factors. So yeah, I mean, I'm happy to share more resources if anybody wants more than that, but the links should also direct you to some evidence too.
Excellent.
Yeah.
Excellent. Okay, great. Are there any questions? Well, we're almost at time anyways. I wanted to quickly just mention that we are, first of all, I hope that this deep dive was informative. We're really trying to, as the title define, trying to go deeper on some of the issues. So we'll be featuring some of the solutions that are the other solutions that were raised at Shape of the Region in our future deep dive. So stay tuned for that. And I also wanted to mention quickly that we're going to be, as was mentioned at Shape of the Region, we're going to be allocating over $100,000 in grants in 2025 to support children's health and safety. So stay tuned. Those announcements will be happening in the next couple of weeks. But I also wanted to just remind everyone the next deep dive session is June 17th. And the topic is going to be around the state of food insecurity for Northern Virginia youth. So if you have not already registered, you can do that. We'll put that in the chat. And we'll hopefully follow up also, just to make sure that people have that registration information as well. So with that, are there any other questions? Thank you. Dylan, is there anything else you'd like to say about the app or what we've discussed today?
I can just add on to
Please.
Dr. Bello's answer about the evidence-based approach of PACES. If you had seen her list of 10 examples, almost every single one of those involved another person, right? The human connection component that is so critical and is also well established in the literature is helping to contribute to protective behaviors in youth. So that was, again, a big inspiration for us was trying to get people together. And in the case of youth, I think peer mentors are particularly valuable. So others of their age, of similar experience, that can kind of speak to what they're going through. So again, that's a big mission of the app, and many of the other things that was discussed here today is trying to bring people together and hopefully foster those positive behaviors. So yeah, thanks again for the opportunity to be here. It's great to talk with everyone.
Thank you so much.
Thank you so much.
Yeah,
Well,
thank you for joining. Okay.
Thank you for joining us, and we look forward to seeing you hopefully on June 17th.
All right.